Welcome to the latest edition of the Mind-Gut Conversation podcast, a place to learn about the latest ideas from thought leaders in the area of health, food, the science of mind-body interactions, and the environment. Today, I have the great pleasure to speak to Kerry Wangen, a psychiatrist with long-standing clinical experience in working with trauma patients in the Veterans Healthcare System, including patients with brain-gut disorders, who has integrated a wide range of approaches to patients with brain disorders, including biological, pharmaceutical, and spiritual dimensions. Dr. Wangen has been an assistant clinical professor of psychiatry at the departments of psychiatry, UC Irvine and UC Riverside since 2012, and has been certified in psychedelic-assisted therapy and research by the California Institute for Integral Studies in 2022. Dr. Wangen has been in private practice since 2022, providing mindfulness psychiatry via telehealth serving California. Welcome to the show, Kerry. There's a lot of things we have talked about in the past informally, so I'm delighted to have the opportunity to really ask you some specific questions that have come out of our ongoing interactions and collaborations. One thing that has struck me, the most from the beginning is how sort of your own career path was interlinked with personal experience about health, and how you have been able to integrate this in a beautiful way, incorporating private practice with your patients, but also incorporating into your own, into your own practice and taking care of your own mental and physical health. So you want to expand a little bit on that, on that point?
Sure, and thank you, Emran, for inviting me to have a more formal talk. I know we've had a lot of offline talks, so this is a great opportunity. Yeah, so before my medical training, I completed a PhD in nutritional biochemistry, and we were doing clinical trials feeding soy isoflavones to people. And I really just dove in and had this experience of having to work with people about changing their diet and monitoring symptoms and collecting samples. And I really saw how hard it is for people to make changes. And I carried that forward when I went into medical school, and my plan was actually to pursue the gastroenterology track. And that was mostly because of my own gut issues I had been having. So we'll talk about that in a little bit, but I found a GI mentor to shadow, and I asked so many questions because I was like, why do all these GI patients, why is there so much depression and anxiety and addiction? And he just would kind of look at me and he's like, I don't know, we don't think about that kind of thing. So he's like, have you ever thought of psychiatry? And I really hadn't, but I started to get really curious because it was very clear that there was things going on at the gut level that were creating psychological symptoms for people. And I wondered if the reverse was true because I wasn't shadowing a psychiatrist yet. So I started to explore psychiatry a little bit more, and then really did discover during medical school, I'm like, wait, the psych patients have a lot of GI issues. So when it came time for my residency and fellowship in psychiatry, it was even more clear that many, many patients were reporting problems with gut issues, in addition to their depression and anxiety and other symptoms. And this was just fascinating to me. When I would go and look into the literature, it's like I really couldn't find anyone talking about the interface in a really scientific way, and just couldn't find the information to work on that in a clinical way either, other than referring someone to gastroenterology. But then what I got back was mostly just, here's their meds and this is what the procedure results look like. So it's pretty unsatisfying. And as you and I have talked about, it's like, wow, why didn't we meet each other earlier? Would have been a great collaboration from the beginning.
Yeah, and I find it really intriguing that, our career paths and directions, how we've entered this field, are sort of mirror images of each other. Because, I came from the gastroenterology side and was unsatisfied with the total neglect of psychiatric and psychological aspects in my specialty, particularly at the time. It's gotten a little bit better, but so I find it really interesting that, you know, we came from the opposite ends and converged on an area, you know, that some people are now referring to as nutritional psychiatry in some ways, or some
I
aspects
think
of it.
that's a great term. And I know Dr. Drew Ramsey, I think, is the one that first coined that term. I've followed his work, and I think that, you know, that's one of the problems with how medicine is set up, is that it's partitioned into specialties, and there isn't a specialty that steps back and looks at the whole person and the interplay between those parts. And so a lot kind of goes untreated in a sense. You know, there's pieces that aren't quite in either specialty that don't get addressed. And I think the patients don't get the support that they really want. You know, they're one person with one set of symptoms, and they're partitioned out into other areas. You know, that was one thing I did like about the work at the VA when I started as a staff psychiatrist in the PTSD program, is there was so much interaction between PTSD and GI symptoms of, you know, heartburn and cyclic vomiting and IBS. And I was able to have a closer relationship with the GI clinic there because the VA is so integrated. So I sent tons of people to the GI clinic and was able to email with the GI docs about, you know, hey, this is what I'm noticing. And it worked really well in that system that's a little bit more enclosed.
Yeah, I mean, if I may ask you sort of a personal question, we didn't really talk about this, you know, what's off limit here in terms of our conversation.
Yeah.
So you had also some, in addition to these interesting experiences with patients and in the clinic from early on, you also had something going on with your own health that sort of pointed in a direction of these brain-gut interactions, the way we understand it today.
Sure, I'm happy to talk about it. I had a lot of gut issues as a child. I got sick a lot with flu and colds and had allergies and skin rashes. But there were GI issues in my family on both sides. So people just used home remedies and over-the-counter stuff and never really had testing. And, you know, I can't even imagine how many boxes of Pepto-Bismol tablets I chewed during elementary school and middle school. But by high school, the worsening health issues were including some endocrine problems, immune dysfunction. I was getting a lot of infections, and the GI issues were pretty much constant. But the thing that appeared in high school was anxiety and depression with it. And I don't think doctors or teachers or my parents really understood what was going on. So, you know, there were all these symptoms, and now I was feeling depression and anxiety, and I didn't really know how to describe what it was. I mean, it's not easy to describe like, oh, I'm anxious, when one doesn't know the word. And so, you know, I started therapy in high school and eventually was seen by a psychiatrist my senior year. And he really got interested actually in the mind-body issues and felt like somehow they were correlated. He couldn't name it, wasn't really sure what to do with it, but, you know, connected the stress and the worry with the health issues. And so I learned meditation at that time. I was about 16 when a therapist first taught me how to do meditation. And I think, you know, looking back, it's funny, I was a psychiatrist and done with my training before I had the aha moment that it's like, oh, that's where the seed got planted to be a psychiatrist and the whole mind-gut connection, because it was really significant at that age.
Yeah, that's really interesting. And if I remember correctly, I mean, you were actually, you got a firm diagnosis about your gut issues. I mean, so I'm really dwelling on this because
No, it's important. You're right.
yeah, because I'm dwelling on this because I see it so many times. I mean, this gray zone that, you know, parents come with their teenage kids to the clinic, or talk about their you know, their infants, and it seems that the early beginning of these brain-gut interactions, they can manifest in different ways. They can manifest as, you know, panic attacks, anxiety, but they can also manifest with severe constipation or diarrhea or sensitivities. So it seems to be, from what I've seen, a spectrum of possibilities how a patient gets into the field of that as an adult and have a brain gut disorder, either what we call or have been calling of a functional origin, so without a tissue diagnosis, or with a tissue diagnosis, such as some kind of inflammatory bowel disease. And I think
And that's kind of,
your story was,
sorry.
your story sort of really illustrates that point very clearly.
Yeah, I think the way that it finally got figured out is when I was in graduate school, the symptoms all got more pronounced, and I saw an allergy and immunology specialist. And right away, he's like, we need to do some allergy testing. He said, I think there's clearly something you're ingesting that is causing some of this. And I tested positive for an allergy to gluten. So went to a GI doc and had just a series of endoscopies over 3 years. And at one point they said it's Crohn's disease, and I was treated with medication for a year, and that didn't really do much. And so what ended up happening, the allergy doc was like, hey, why don't you just stay off gluten? Let's have you shift to a whole foods diet and just be really meticulous and see what happens. And that made a huge difference in both mind, my brain function got so clear. I was happier, I was calm, and I was in graduate school, which most people aren't that happy when they're working that hard. And so it was funny, along the way, I always had GI docs, and they said various things. And then when I came to Long Beach and was working at the VA, I saw a GI doc in 2012, and he looked at me and he's like, I'm 99% sure you have celiac disease, and I'm going to find it. And so he did a capsule camera study. He asked me to eat gluten for 2 days and did a capsule camera study. And he said 100%, like it was the damage that they could see with just 2 days of gluten eating was clear enough to make the diagnosis. So that really helped me to finally have a label to put on it and to know that I needed to be strict with the gluten. And it makes such a big difference in how I feel in day-to-day life. So, to me, I was sold after seeing my own experience. And it's like, this really does matter to people. And so if my story helps somebody to be more vigilant about taking care of themselves, it's absolutely worth talking about.
It's a very important story, in several aspects. That this presentation, both in the psychological domain and in the gastrointestinal domain, and then coming up with the correct diagnosis. Not because there's obviously several inflammatory bowel diseases like Crohn's disease and ulcerative colitis. Sometimes, in some patients, they may present not with the classical GI symptoms. And then there's also this entity of non-celiac gluten sensitivity that, in my opinion, it's a pretty strong personal opinion, has been, a lot of patients have been mislabeled with that diagnosis. And it's still hard to actually pin down what the biological basis is. Whereas celiac disease, obviously, we know exactly, what the biological mechanisms are, and that it will respond to the elimination of gluten from your diet. So I think your history really illustrates several really important points. I think that a lot of patients might recognize themselves in.
Yeah, part of the other piece, when the diagnosis didn't become positive on me, they did do a cheek swab, and I had both copies of the gene associated with celiac. And turned out my dad had it, my sister had it, and they both went on gluten-free diets, and all their GI stuff cleared up too. And so I was like, yeah, don't worry about getting scoped. Let's just try it and see what happens. Because neither of them were excited about having endoscopy procedures. And so my dad lived gluten-free until he passed away, and my sister has stayed very rigidly gluten-free. And so that was probably, is obviously on both sides of the family, since I had both copies. So, what an interesting thing to think of, how much of my family suffered and didn't know. And there was anxiety on both sides of the family too. So it's curious if it was related.
Yeah. So this is one, I mean, we're going to come to another sort of really intriguing aspects of how your personal experience, with meditation and relaxation techniques, how that has influenced your career path as well. And but I first want to go to this. So you practiced for, are you active in the VA
For 10 years.
for 10 years? And I would say, having worked in the VA myself at some point of my career, you've seen a very unique population. I mean, how would you, as a psychiatrist with a brain gut, particular brain gut interest, how would you describe the kind of patients that you saw at the VA?
I was in the PTSD program, so specialized in that area. And when I started asking, when I first got there about GI issues, it was 100% of the people that I was seeing. I mean, these were people with a lot of stress chemicals going through their bodies, in a state of a lot of stress, depression, anxiety, a lot of sleep problems. But I was really stunned that it was literally 100% with heartburn or ulcers or cyclic vomiting, diarrhea, appetite issues, IBS at higher rates, IBD at higher rates than would be expected. And I had the great fortune of being able to do a weekly meditation group for the veterans in our program. And I'd always do a couple minutes of teaching about a health topic. And I introduced mindful eating. I would usually do it right before the holiday season, and then again sometime in the spring. And so many of them came back and said it's made a major difference in their heartburn by learning to calm themselves and let their nervous system switch over to digestive mode. And I definitely noticed from what they were telling me that when their PTSD symptoms got worse, their gut stuff got worse. There was a direct link. It's like stress and anxiety goes up, sleeplessness goes up, digestive symptoms go up. I think the part that shocked me the most, though, is how many of the young men and women that served in Iraq and Afghanistan, when I did intakes with them, wouldn't say anything about their gut issues. And when I would ask, they're like, oh yeah, I throw up probably 4 or 5 mornings a week. I've just learned I can't eat until noon. And I'm like, what's that about? And, referrals to the GI just yielded this cyclic vomiting title. But it was so pronounced in otherwise fairly healthy individuals. They had heartburn as well, but yeah, it was just, unbelievable to me how many physical problems they would walk around with. And, no wonder a lot of the symptoms of depression and anxiety and some social withdrawal. So yeah, it was really deep, heartfelt work for me to do.
And I imagine from what you said, the patients were actually quite receptive to, I mean, did you introduce them to the concept of the close bidirectional brain gut interactions, and were they, and that meditative or contemplative techniques would be beneficial? Were they open to that suggestion?
They were, because they already knew there was a connection. Like on some level, they could feel it, and they could see PTSD symptoms and gut symptoms traveling together in peaks and valleys. And I still remember the first meditation group that I decided to introduce the topic. I was like, does anyone in here have heartburn? And like every hand in the room went up, and it was like all ages. There were like 25 people. And I was like, okay, then, I've got a willing audience to participate in this mindful eating exercise.
Yeah. So other than PTSD, I mean, what would you say within the VA population, that's kind of the main psychiatric issue that you have encountered?
There's a lot of depression, anxiety, and addiction, psychosis. And I worked some in the substance use program as well. But I was primarily PTSD.
Okay. So I mentioned it earlier. So you have this unique interest and extensive experience in your approach, unique approach, holistic approach to psychiatric disorders. Did you was that kind of based on your own personal experiences that many of these techniques have helped you in your own, struggle to find balance or to reestablish balance in your mind-gut interactions or health in general?
Yeah, that's a great question. It did start that way because I was first taught meditation techniques by a therapist when I was 16. I just listened to guided exercises, and I did that in high school, not so much in college, but when I got to grad school and stress increased, I decided to start looking for a meditation center, and I was reading books about meditation and added the topic of spirituality because of the overlap, obviously, and started going to yoga classes. And it was around the time I was finishing up my PhD and I knew I was going to roll right into medical school that I thought I'm going to need more stress reduction tools for sure as I enter medical school. And so I started attending a Zen center locally. And that's when I made a commitment to a daily meditation practice, which I've continued for 22 years. I mean, it's rare that I miss a day. Even if I'm flying on a plane, it's like, worst case scenario, I do a sit while I'm on the plane. Because it really, the meditation was such an important piece of my own physical well-being. But as I got into psychiatry and seeing that interface between, what we're doing in our mind and spiritual practice and the physical body, it really did turn into more mind, body, and spirit at that point. And I chose actually to come to University of California, Irvine for my psychiatry residency because of one of the staff members, Dr. Roger Walsh. He's a psychiatrist, author, speaker, and teacher of meditation. And I had heard that he hosted an evening meditation group for the psychiatry residents. And I was able to participate in that it was about 15 years. And it was amazing. We discussed all different types of growth practices, meditation techniques, and we also talked about how do we bring these practices into our patient care. We started to offer guided practices to the patients that were both in the psych units and on the medical floors where we did consults. That was really rewarding, and continued to just discuss this mind, body, spirit and how it relates to illness and healing. So it was really a life-changing part of my education.
Yeah, that's really, I would almost say you could call yourself a wounded healer, which is often sort of a, term used for some of the most effective people in working in therapy and helping others, that you've had experiences, you've learned to appreciate some of these techniques that have helped you, and you apply it in a very effective and convincing way to your patients.
Yeah, that I accept that title. I mean, it fits for me when I think about it, because if I had not had the health problems, I don't think I'd be the person that I am. I wouldn't be the psychiatrist that I am. I had one very big year in the training in 2007 where I just became a little disillusioned with what I was learning in the psychiatry residency program. So I stepped away for a year, and Dr. Walsh and I put our heads together and I designed a year-long mind-body fellowship. And I did about 6 months of the year in silent retreats, and then a lot of studying with teachers and healers from different traditions. And it was also an opportunity for me to learn more about my body. My symptoms had definitely gotten a little worse under the stress of the first 2 years of psychiatry, because I didn't feel like the medications alone were really making the difference for people that I wanted. So stepping away was just transformative. I mean, that was probably the most important year of all of my training. And it wasn't in the academic setting. It was actually the year I stepped out with his mentorship and did, a lot of long silent retreat. And that helped me get in touch with, the real healing capacity that we all have.
Yeah, that is remarkable that, particularly I would say in psychiatry, where a common interaction between patient and physician is really just the dispensing psychoactive medications, and a very brief encounter,
Mhm.
and then monitoring potentially the side effects of the medication, but not that sort of deep connection that you're talking about, and a holistic spiritual link with the patient and the context they're in, and the situation that they're in.
It was really interesting. Twice in long retreats, I actually intentionally ate gluten because it was, part of the menu, and decided I was just going to really monitor myself with the meditative practice and the experience, and to watch, within an hour of eating it, like my mind got foggy. And I remember just the sensation in my belly, and I was imagining it was like I had swallowed a bunch of razor blades or something. I could feel like this burning and cutting, awful sensation. And then to watch that it was, about 36 hours to really clear the mental fog that came in from, one small serving of a gluten-containing product under the mindful conditions of a silent retreat.
That's really amazing story. Yeah, so we talked a little bit about this, but expanding on this situation right now, there's a growing popularity, obviously, of contemplative practices and Buddhist principles in form of different forms of meditation, empathy, compassion, in patient care. And I've had a little bit of insight in this, having attended a couple of meetings of the Samueli Institute in Alexandria, or military, and I forgot, if it was the military or veterans organizations came in. And it was amazing to me how they embraced, some of the earliest in the medical system, how they embraced those kind of concepts and aspects of these non-medical principles. And you talked a little bit about how you have been able to integrate those into your own practice. So you've done this successfully with your veteran patients, but now you actually are in your own practice. And how do you continue this? So it's a virtual office that you're running. How can you continue some of those practices online, and how effective is that?
You're pointing at a really important part of my transition out of the VA. I so appreciate that the VA did integrate, and they're really supportive of using mindfulness practices and relaxation and mantra repetition. But part of it was that wasn't the mainstay of what I could do with patients. I had a lot of other requirements, VA related, and it just came to a point that it's like mindfulness and different meditation, diet are so important in my view of helping people heal, that's what caused me this year to step away and say I want to start doing private practice instead. And so far in the practice, I mean, I love it because it's a much bigger piece of how I'm working with people, both mindful awareness practices to help them learn about themselves and what's going on in their body and mind, and to start to see some connections. Also teaching meditation skills. I use compassion practices and helping them get in contact with that inner critic voice and learning how to nurture themselves instead of having, getting angry at the critic. It's like to be able to use a compassion practice to soften that. And then also, more time to work on behavioral change strategies to help them adopt a diet. It's not easy to make nutritional changes at all. And so if I'm really going to be able to help people and support them on the mind-gut level, I needed more time, space, and freedom to be able to use the tools that I felt like were most effective. And it's such a joy. I'm really having a lot of fun. I've a couple times thought like I should have done this earlier, but that wasn't the path. And I don't regret the 10 years at the VA at all. It was a wonderful experience.
Yeah, this is really wonderful to hear. And also that, that you can do this through Zoom encounters, through virtual encounters, that you don't have to, which is obviously in a place like Los Angeles, always a big limitation. are people able and willing to drive an hour and be stuck in traffic, and then do a meditative practice when you're stressed out from having gone through. So this has really opened up, I would say, this whole virtual office situation has opened up a whole range of new opportunities for the kind of holistic approach that you're practicing and you're promoting.
Yeah, I do think it really, you're right, it helps them to be at home and to be able to do a practice. And sometimes, at the end of a session, they're at a spot where they're really in touch with some compassion for themselves and what's going on. And so I just encourage them, like, just, close the screen. Do you have 20, 30 minutes still? And they do, so they can just slide right into staying in that state instead of kind of turning on and turning off and driving through LA traffic and all of that. And I think the mindfulness practices of being able to sense their reactions to things in the environment, and also to notice how they feel when they're on different types of diets, it's so key for the mental health piece. It really is. If they don't know what's making them anxious or sad or depressed, it can take a long time to figure out which type of therapy is going to be the best. How do we fix this? And so, by teaching even some basic relaxation and some basic mindfulness, it can be a real game changer for people.
So let me switch to a question that addresses a topic that I've heard a lot about recently, both in the media and in the scientific literature, also from some patients. And this has to do with this, and the Netflix series about how to change your mind, obviously, it's had a lot of impact. So what is your view as a holistic psychiatrist who incorporates a lot of atypical or non-traditional elements into her practice? What is your view of this concept of psychedelic enhanced psychotherapy or therapy in general?
Yeah, so I'm a little biased. Just this spring, I completed a year-long training program with the California Institute for Integral Studies in their certificate for psychedelic-assisted therapy and research. So it tells you I've already dove in pretty deep into the topic area. And, I really do think that MDMA-assisted therapy is going to have a big role for PTSD treatment for both individuals and couples. That was what drew me to doing that training program. And my hope is that it's going to be very accessible, especially to veterans and first responders who may benefit from the therapy. But yeah, there's challenges. I mean, the logistics of how to provide this care in different settings, and also how do we work out the cost? I mean, you've got session days with the medicine of 7 to 8 hours, and the protocol is set up for 3 of those a month apart. But then you've also got prep sessions before and integration sessions after. So it's an enormous amount of staffing time. And, I just think with making sure that the emotional safety is there for patients, since they're having the treatment because they've had trauma. So we really have to figure out how to do it right.
Do you think there's a danger? I mean, it would seem to me, and I've heard this from several people active in this field, that what the medication does, it sort of opens up things in your mind, in your emotional memories that you didn't have access to before. But then the real work has to come from integrating this open up Pandora's box. I mean, to integrate the pieces. Doesn't this require like really well-trained, experienced therapists that can actually do this effectively?
I think it does. I think it takes therapists who are trauma informed. And, I had the unfortunate situation where I had a few patients that read about MDMA and, went out and did it on their own, and had a whole bunch of stuff come up, and they were either alone or with, a friend or two, and had some really bad experiences of stuff coming up that they hadn't really remembered. And so felt worse because of it. And so, I think that is a big caution. But, you look at the data of symptom reduction, and it's just, it compelled me to go into the training program. It's like, okay, I'm going to have to do this on my own time. I was still at the VA. I'm going to pay for it myself. But that's how strongly I felt about getting the base. And there's a lot of us. I mean, it's about 180 per year coming out of CIAS with the certification. And so there's a lot of providers out here like ready to start doing the care, and also many working on research protocols right now, thankfully. And so, I think we'll learn enough through the research protocols to hopefully roll it out correctly.
Do you think this could sort of revolutionize? I mean, psychiatry, the development of novel effective therapies has really been stagnant, to say the least.
Mm-hmm.
Do you think these kind of approaches have the potential to really revolutionize what psychiatry can do for certain disorders?
I do. And, I really think too, besides MDMA, the psilocybin protocols for end of life anxiety and for anxiety due to life-threatening illness, it's such powerful work. And the use of psilocybin for also anxiety and depression is really promising. And so I think, MDMA looks really promising for PTSD, and then psilocybin, I think, is going to have a big impact as well. I mean, the data there, imagine, someone in their final stage of life who's dealing with a lot of anxiety and pain and the loss coming up for their family and everyone else, for them to be able to get more peace in that final stage, and for their family to see that they're at peace. I mean, what a gift. We don't have any psychiatric therapy or medication that can do that at this time. And so I think that's incredibly promising area as well.
Yeah, it sort of makes me really look back and, my own career decision or struggle between psychiatry and gastroenterology, with these exciting aspects on the horizon. I mean, it's almost, would love to go back and be able to make a choice being part of this revolution. I think it's really exciting.
You have so much diverse experience. There's no problem for you stepping over into our camp. I think that would be an easy transition for you too. The one caution that I will put out is, I think that some people are looking at these as being a total revolution. Like, this is going to work for everybody in all settings. And I just think it's wise for us to be realistic that they're probably not going to work for everybody in every situation, and that they really need to be used in the right setting and with the right support if we're looking for life-changing and not causing harm. And so I do watch, some of the listservs, and it's like, oh, this is going to revolutionize. Like, there's going to be no more depression and no anxiety, and all PTSD is going to be cured. And I'm like, hold up.
Yeah.
let's slow the enthusiasm just a little bit.
So the last thing that I'm going to say or ask you a question. So it's I've always been interested in these ancient healing traditions. I can't tell you why that is. I mean, even from college times, I've read about this, have gone through many of the, I've also spent time with the UCLA Zen Center, with the Los Angeles Zen Center. And it's kind of nice to see how how many principles of ancient healing traditions are coming back into, I mean, I wouldn't say mainstream medicine. I mean, there's clearly, there's developments of mainstream medicine that's going off in another direction. Like in my specialty, just doing procedures or becoming something very different from the kind of healing or looking at the whole body. But I think for family practitioners and for people that look at general health issues, this is kind of an interesting phenomenon that all of a sudden it was an outlier. So remembering when I was in training for gastroenterology at UCLA, I would spend my weekends in places like Esalen or the Ohio Foundation, probably the only gastroenterology trainee that was present at these esoteric meetings. But that has changed. I mean, there's now, wellness groups at UCLA, there's at the VA, you said, and
Mhm.
Um, this is an interesting trend in general in society, that we're sort of reintegrating things that we've totally ignored for the last several hundred years, except for a few
Mhm.
outliers, Um, I mean, how do you see this? You certainly practice, many of these things yourself, and you apply it to your patients. Do you see this also, that many of your colleagues will go the same way and adopt and integrate some of those approaches and philosophies and
Yeah, this is such a fascinating area, and I know we've had discussions on this prior. The potential seems huge for me in this area as well, and I feel like I'm just a beginner in my study of these types of areas. I've had some deep experiences when I was doing chanting at different chakra levels with a teacher. I've had some experiences of what people refer to as Kundalini energy during meditation and during breathwork yoga. And so it's like I've had these glimpses of like, wow, what's this? This is something very different than just my usual meditation practices. And I have noticed, over the years of meditation, that there is clearly like these centers of energy in my body, belly center, heart center, head center. Like those are a lot of practices. You're very aware of being able to move awareness between those and what's kind of happening in those centers. But I feel like I'm a beginner just learning how do I open this up and how do I work with this at a basic level. But I think there's going to be profound interactions with these practices and what's going on in other streams of healing. As we learn more, what is the brain about? How do we work with the energetic component of the different organs in the brain? And so it's a super exciting area. It's one that draws my interest quite a bit.
Yeah, and as we talked about, we definitely have to follow up this conversation with something specifically targeted on this, and maybe bring, a third person in, an expert on energy healing. Because I've also found that fascinating, with the whole, what goes on in your gut, which has its own nervous system. And I've really focused all my interest on the gut, but then you realize there's also the heart, the compassion, and which is a
Right.
different. And how have these ancient teachings? I mean, how did they come up with these connections? I mean, what made anybody think about like a meditator that this has to do something with the gut or something with the heart? So that we are coming to this now with the science, but people have realized that like thousands of years ago. So I think I'd love to have that conversation with you, on this link between ancient healing traditions and modern science, and what this means for the clinical practice.
Yeah, I remember a story that one of my meditation teachers has told over the years, Spirit Rock affiliated teacher, about when they were doing some research on the monks with the Dalai Lama's group. And the researchers went over and they were going to do, all the measurements of the brain. And when they walked in and told what they were doing, and the translator translated, the monks all like kind of giggled, because they thought it was here that they should be looking at. And the fact that they were looking here made no sense to them.
So
And, that's my experience with meditation too, is once you're really rested, it's like information just comes up, and it doesn't feel like this is the most logical place to live life. It to me, it feels like, wisdom comes out of the gut, compassion, care, and connection comes from the heart, and the mind should just be the one that communicates that into the world, and then, brings some information processing to send it back down. But we really, medicine teaches us that everything that we have to offer people is up here. And I think we're ready for a change, both you and I personally, and how we work with people, and medicine in general, that we drop more into heartfelt and gut intuition.
Yeah, I can't wait for this conversation. So it's definitely on my to-do list, and you'll will be hearing from me about
Yeah, I would
when we
love
can
to participate.
schedule this. So anyway, so we've come to the end of this wonderful conversation. I really enjoyed it. You know, could go on for a long time, picking your brain and your amazing experience and knowledge in this field. Do you want to make a few closing comments in terms of, you know, something that we have not touched upon during this conversation?
Sure. First of all, thank you so much for having me, and I'd love to come back for that part two. I think, you know, one message I want to make sure people really hear is that what they eat can have such a profound impact on how they feel, on mood and anxiety and stress. And so to really not underestimate that diet change can be very effective in helping people. And also the use of mindful awareness, of tuning into oneself and, you know, internal feedback and external feedback. It turns someone into like their own detective of what makes me better, what makes me feel worse. And so I think mindful awareness is such a great tool. And in closing, you know, I've had the privilege to receive training from so many outstanding physicians and nurses, teachers, patients, and mentors over the last 30 years. And I've been really so lucky to have had the wide range of meditation practices and teachings. It's just been a gift for combining, you know, my own health and practice together. And honestly, you know, at this day and age, I look back at my own experiences with health challenges, especially the mind-gut issues, that it's really turned out to be a gift. And it's a gift I use to be able to help others. And so, you know, there isn't that like, oh, why me stuff that was floating around in my 20s. Like, why do I have to have all this stuff? And why can't I eat that croissant? And, you know, there was more whining back in the 20s. And now I look at it and it's like, this is why I can be effective in helping other people. And so it really, I'm just so lucky that I had the access to all of the teachings and the teachers, and the patients being one of the best teachers along the way.
Thank you again. You know, I have to say, having met you, you know, about a year ago, and in our conversations, this has really been an eye-opener, and learned a lot from you that I'm incorporating into my own work, and I'm sure a lot of the listeners will really enjoy this conversation that we had, and the points that you addressed. And so thanks so much. Really appreciate it.
Yeah, and thank you. You know, it's been so healing to meet a GI doctor who's so interested in this area and sees it. It just feels like this ultimate validation that it's like, oh, I knew they were connected. And now, you know, to have such a high-ranking, accomplished UCLA professor that's like, of course they are. This is the area I'm interested in too, has just been wonderful, Emran. So thank you for having me on today.
Thank you. Bye-bye.
See you next time. Bye-bye.